Hello, everybody, and welcome to this discussion on functional wellness. My name is Michelle Desser, and I am proud to be part of Functional Movement Systems, where over the last 30 plus years, we've stressed the importance of looking at movement patterns to help both fitness and healthcare professionals make appropriate decisions for the individuals in their care. But we're always learning, and we're always looking for opportunities to move health and wellness in a forward direction. We know movement health is a vital sign to overall wellness, but humans are some of all their parts. What does that exactly mean? Well, let's just say I have low back pain and I'm in the care of a healthcare professional and they're helping me move better. But you know what? I'm just not sleeping well or for very long. I have a lot of life stresses on my personal side. I'm not eating as healthy as I should be, and my physical activity level isn't very high because I'm just tired and I'm unmotivated. Could these other areas of my life affect the forward progress of my low back pain therapy? Absolutely. As wellness professionals, we need to take this holistic, multifactorial approach to overall health. That doesn't mean we need to be experts in all these categories, but we need to be aware, and more importantly, we need to bring awareness to our clientele of these different areas. Our mission at Functional Movement Systems is always to affect positive change to musculoskeletal health. This mission led us really to evaluate our own system and recognize that we needed to bring this awareness to all the parts that make up the whole human. We're here today to share with you our newest educational piece, our Functional Wellness course, where we introduce you to a new way of thinking about long-term musculoskeletal wellness. We have our two co-founders, Greg Cook and Lee Burton, here with us today to share this information with you. So without hesitation, let's get started.
Thank you, Michelle. I want to thank everyone for joining us today. And Michelle, you did a great job of teeing that up. And this is something we've been working on for quite a few years. I think it probably, Greg, goes back to 2016, 2017. We started really playing around with this idea of trying to make a more efficient way to screen, something that we wanted to look at a little bit deeper. And let's be honest, going back to 1996 and 1997, when we actually developed the functional movement screen, we were already even then thinking about how can we create something efficient, effective in how we're screening and looking at movement. And from day one, we were trying to think about things we could do to make it quicker and easier. And over the years, really what has occurred is that people continue to ask us that, how can I take this movement screen you guys created that we've proven over the years through both research and feedback is a really effective tool in how to look at movement competency. How can we take that and make it better? How can we take that and make it a little bit more efficient? Number one question we get, Gray, is, hey, I deal with a lot of people. How can you guys scale the movement screen? What are some of the ways I can screen movement without a test kit? What are some of the movements I can eliminate? And we were pretty, adamant, even today in certain situations, you need all 7 patterns. But we took that and ran with it. And when we took that and ran with it, and even going back to your athletic body and balance days, you had a self-movement screen. We wanted to think one of the best ways for people to really lean in, and we even saw this with a functional movement screen, is give them the ability to screen themselves. And you did that in athletic body and balance. And we took that on back in 2016, 2017, and we said, all right, let's create that. But we need to be thinking about the other factors that Michelle just mentioned. What are the other things that we need to be looking at that impact movement, both positive and negatively? And where we landed and what we're really excited about launching today is the functional wellness screen. Now, Gray, this word wellness takes on a lot of different meanings in a lot of different environments, but when we really landed on wellness, it really came from us really diving into musculoskeletal health. And right now, if we look at the state of the world and where we are as a population as it relates to musculoskeletal health, we're in pretty bad shape. Right now, it's the number one insurance expense, meaning low back pain, knee pain, neck pain, all of those things are why we miss work or why we go to the doctor. It's, a lot of those dysfunctions and ailments are creating all kinds of other secondary problems we don't even think about. So our musculoskeletal health is a real problem. And we've been, I would argue, at the tip of the spear with movement screening and trying to positively impact that. We haven't done that very good of a job as professionals. But when we went down this road of trying to impact musculoskeletal health, try to improve how we're looking at movement, we landed on a functional wellness screen. But we first need to really think about what is wellness anyway.
Well, and I felt as vulnerable the first time you asked me that as I made myself feel when, as a young clinician in the mid-90s, I had a pretty extensive background in functional exercise. I was a strength coach. I was a PT. I had an Olympic weightlifting certification. There were a lot of just different stuff that I got about exercise. And everybody that wasn't bodybuilding was calling their approach to exercise functional at the time. But there was no scale with which to graduate from a functional workout to a performance sport-specific workout. So everybody had an appreciation for function, but until we had a scale, everybody thought they were doing it. And I find that wellness, what a popular term. It's been around since we were both in college, but it's so frickin' vanilla that nobody does anything with it and everybody assumes they got it. And here's the two things I want everybody to understand. A touch with healthcare doesn't make you more well, and a touch with fitness doesn't make you more well, because the risk factors aren't being measured and modified and managed. So wellness is a projection of the future, whereas your state of health or your state of fitness is almost how ready you are at any given time. And so your health is defined by your vital signs, and your fitness measures are usually defined by a few definitive tests that are age appropriate and activity appropriate. But wellness is a future projection, almost like my prognosis. So let me tell you one thing that I use as a very effective analogy. And I'm going to give you a clinical example and a training example. If I am a weight loss consultant and I know, Lee, that you have extremely poor sleep, I got a better chance of fixing your sleep than I do managing your diet right off, because I can't undo that cortisol you're creating with broken sleep every night. So I don't have to be a sleep specialist, but I do know how to discuss how to make you more aware of your sleep with a wearable. I do know how to discuss the things that can kill your sleep and protect you from bad sleep hygiene. Long before I got to worry about whether I got to tell you melatonin or vitamin D. I don't have to worry about that. There's so much. I can make your sleep way more well just by a few discussions and a little awareness. Now let me take you over to physical therapy. Your mom comes to me with a frozen shoulder. If she's a type 2 diabetic, double the time. No matter how good Gray Cook is with shoulders, because she's a type 2 diabetic and because her tissues will not heal and respond to the stress of rehab at a predictable rate of a non-diabetic, I double extend her time, and it's accepted. So these are two things right now. I'm here for weight loss, not sleep counseling. I'm here to get my shoulder done, and it shouldn't take as long, because hers only took 8 weeks. Yours is going to take 16. And it's these extenuating circumstances, these complexities, and these baggages that people bring to both rehab, fitness, and sports. And we call them risk factors. But people don't like to talk about risk factors. They like to talk about goal attainment. They like to talk about their next new supplement. But I hate to say this, most of what you're seeing that is framed as a wellness upgrade on the internet is a patch, not a path. Because a path requires dedication and awareness, and a patch, you slap it on and assume all is good.
Well, we've been talking about the problems that we have as it relates to musculoskeletal health. It's no different than wellness. If we look at some of the data and look at this graph right here, it shows that there is an inverse relationship with how much time and resources and energy we're putting into wellness. And most wellness programs are providing more education and more things that you should be doing. Let's be honest, Gray. Everybody around the world knows what they need to be doing. Right. They're just not doing it.
Right.
And the data tells us that. So we're putting all this energy into wellness. Health's getting worse. So our health, musculoskeletal health, overall health is getting worse, even though we're dedicating all this time and energy and resources into this. And really, Gray, what I find interesting is the fact that we have taken everything we've learned through movement in our movement screening, and not just looking at the fundamentals of movement screening, but the philosophy with which we developed our tools. Screen, test, assess, protect, correct, develop. And let's take those same rules and apply them to wellness. And the first word I'm going to get you to really discuss in more detail is the word functional. How do we, and why did we even slap functional on the top of a movement screen? Because at the time, it was pretty in vogue, if you will. Everything was doing functional. Everybody was slapping bands on somebody, and swinging a bat, throwing a ball, all those things. Well, we took functional and put it on movement and a screen. And by doing that, we had a little bit different approach. And it really goes back to going to what's good enough.
Well, I think a lot of people migrated to functional workouts as exercise science majors when they didn't have a background in heavy lifting, right? And so there's this other path in exercise. And in many cases, it's about getting you off of machines and getting you out under inappropriate heavy loads. But ultimately, if you really like functional exercise, you wind up getting stuck almost in corrective exercise, thinking, I'm going to polish the paint off this car. It's going to be so shiny. And function means good enough. Good enough not to add additional unpredictable risk, and good enough to afford you an adaptation opportunity. So if your biological system is reading the kinesthetic, visual, auditory, sensory information in your environment, is that skewed? I can tell you this. If you have a dorsiflexion restriction or a single leg stance balance problem or a T-spine rotation problem, you're already watching your life sideways. Have you ever watched a TV so much sideways that you know what you're watching, but you can't see anything in clear detail? So my point is, your sensory experience with life is interrupted every time one of your sensory mechanisms is dysfunctional. So long before we're talking the biomechanics of ankle mobility or single leg stance, you're already obliged to compensate automatically the minute you go vertical in the morning. And that's a very cloudy windshield to observe life through. So the one person you don't ask about if they can drive is the drunk guy. But you also don't ask a hypoxic person if they can breathe well. And if you're hypertensive, I don't care how you feel. You're at risk. So there are certain signs that we could act on long before the symptoms present, because that's why I think that inverted graph with healthcare, today's client, patient, athlete has been afforded so many goods and services to stay comfortable in a dysfunctional environment that the day they break, there's a whole lot of shit to unpack other than their bad back.
Right. You're covering, it's so easy to cover things up without really taking on what is most important. And what is most important is your weakness, is the problem that you have. And the one analogy that I always use, I take it from you, is it's the eye chart. If you walk into your eye doctor, the first thing he's going to do is look at an eye chart. And if you pass, and you don't have to be an eye doctor. Back early, and I don't think I remember doing this in maybe elementary school. You would do the eye chart during your elementary school days. And it was just to see, do you need to dive deeper and go to the eye doctor, or do you have 20/20 vision? And that's really how we need to approach the first step in this process.
No, and think about that. I've often reflected on this. We went through school only a few years apart, but there was scoliosis.
Quite a few years apart, by the way.
There was scoliosis screening and there was eye screening, because a lot of times pediatricians didn't pick that stuff up until it started to impose problems. But why would you visually screen a kid? Because a kid's whose vision is getting progressively blurry, they accommodate for that and they just squint and they make mistakes. And so assuming the child is not intellectual enough to be in your class is a very bad assumption if you're not checking the number one way they're learning, which is from 30 feet away looking at your blackboard. And so, looking at these sensory things, a kid growing up with scoliosis is having to get their eyes back level regardless of how crooked their spine is. So they're going to have certain things. So remember, the PE teacher that scoliosis screened me wasn't an orthopedic. And the teacher that visually screened me wasn't an eye doctor, yet they felt extremely comfortable screening. And so when I talk to clinicians and coaches and trainers about, hey, you should be screening these other domains. Well, I don't have a lot of nutrition background. Yep. But if I gave you a list of 5 inflammatory foods and the people that you were training and treating weren't recovering at a normal rate, removing the inflammatory foods, because when you're working out, you're creating inflammation. You shouldn't be eating it too. So we could get you hydrated, a little bit better slept, and remove some inflammatory foods from your diet. Website, deflame.com. Go look it up. It's not hard, but it's all the crap you shouldn't be eating anyway.
But the thing that we want to get into, Gray, we took that approach and applied it to the idea of wellness, functional wellness.
Exactly.
i.e. the functional wellness screen. And that's where we start thinking about what does the research tell us? And what we found with the research, looking at the movement screen, that if you look at movement screening and the results of movement screening, there's some things that relate to higher injury risk. If you've got pain, significant movement dysfunction, if you have asymmetries between right and left, again, lack of ankle mobility, a lack of balance creates significant movement dysfunction. There are certain things that if we look at the research and the data, movement-based wise, relate to injury risk. But if you start adding in other factors, and Michelle mentioned it to kick off, multifactorial, the other factors that we need to also consider that will even more increase or decrease, depending on where they are, where those numbers are, your musculoskeletal health, or i.e. injury risk. And let's just look at it as musculoskeletal health. Let's not just say injury risk, because we want to be proactive. We want to be proactive in wellness, and we want to look at these 8 areas right here. And when we start looking at the data and the research, this is where we landed. Your breathing quality, your sleep, your nutritional awareness that Gray, you just mentioned, your movement health. And we look at movement, but you don't necessarily have to do a full functional movement screen. We've taken the idea of scaling this thing down and remove a test kit. Get the person to do these things on their own or proctored by a professional. Your physical activity. Is someone exercising or not? If they're not physically active, we already know that's a problem. We already know that they're more likely to have a musculoskeletal health issue. What's their stress level like? What's their behavioral health look like? Are they under a lot of stress at work? Are they going through a problem in their personal life? If they are, no matter what exercise you give them to decrease tension, it's not going to be as effective if they don't have some of these things. So all the things we got right here, their injury history, aren't just our opinion, Gray. The data and the research and the evidence has suggested we need to be considering all these things if we truly want to be trying to do a functional wellness screen.
No, I agree. And the first time we ever took these 8 domains and organized them, my brain started trying to do the same thing that we did with a movement screen. We have 7 different movement patterns, but there is a priority there. I will work on your leg raise and ankle mobility before I'll work on your deep squat, because your deep squat is a very, very total body involved pattern, whereas I can see a little bit cleaner what's going on with your hips if I do a leg raise, and I can see a little bit cleaner what's going on your ankle if I do a mobility screen. So there is a hierarchy of considering this, because when you and I talk ankles are a big problem in high school, the number one thing I hear my coach say was, well, we added an ankle stretching station. That's good, but a true learning loop is information. You got to check their ankles. Action, you added the station. Reflection, did it make a difference? And adding a station or giving somebody sleep education and not compelling them, sleep is your weakest link. If you're not in a wearable, you're not going to know, because you already have enjoyed 3 years of below average sleep thinking that's normal. Same way with monitoring your breathing or monitoring your nutrition. There are apps right now that'll take a picture of your food. We'll figure it out. But if you look at that top row, people don't usually complain about the top row until they're in a severe problem. But where does most of the sales marketing of today's wellness client come? Activity level, behavioral health. We're going to motivate you to be more active. Body composition, we got to lose weight. Well, we got a shot for that now. So you don't have to think about it too much. Just sign up for the subscription for the rest of your life. Or injury history. I have a lot of people that want to talk to me about their past injuries, but I'm more interested in how they screen now, because the past injury, I see a lot of people with a total knee. Some are very, very functional. Some are near disabled right now. So your past history tells me something, but it doesn't give me a complete picture. The point is, most people want to keep conversation at the bottom row. And I think these are observable markers that we must watch. The ones I want to take action on that are easy as an Apple Watch or a mattress app right now are breathing quality, sleep quality, nutritional awareness. And then we've got this movement health. And I'm glad you brought that up, because the thing that sent us to movement screening in the beginning we weren't even looking to be more proactive. We were looking for one extra competitive advantage in the way we rehabbed and trained athletes. And we realized everything was either a healthcare discussion or a performance discussion. In the bridge between your stress recovery cycle and your next new thing was this movement screen. And believe it or not, the FMS has a push up and a lunge in it that are damn hard. To your point, I don't need somebody doing that because my mom and dad are a fall risk whether they can do a push up or not. So there are certain tests we do in movement screening that if you're getting ready to change your body or go into what I would consider an upgraded environment, you better do all 7 of those patterns because they're going to give us some insight into an active individual's responsibility. However, if you're just kicking around wondering where you rank, we can give you about 5 little maneuvers that are really more focused on your balance, your posture, your symmetry, and what I would consider your daily flexibility requirements. And when I say that, if you don't own these, you are obliged to make a compensation in many normal maneuvers like standing from a car or twisting to get something off a shelf.
Right. Yeah. And the one thing that we have to really make clear here, Gray, is too often, or one of the reasons I would even argue why we got here is too often people look at these in silos. They don't realize that all of these 8 areas are interconnected. How you're breathing is going to impact your movement. How you move is going to impact your breathing. How you're sleeping is going to be impacted by your breathing and your stress and all this stuff. So one, we have to look at this as good enough. We have to look at this as where are you? When we say good enough, that means you have met the minimum, a minimum amount or minimum area that you need to be in, that it's not going to negatively impact the other 8 things. So we look at all of these 8 areas, all we're simply trying to do, take our approach, screen these out. You don't need to be an expert, but you need to consider all of these things are important to your ability to improve, but also maintain where you are. I don't care if, and here's the other thing about this, Greg, these change. These are all behaviors. These are all dictated by your lifestyles. And, we have movement as one thing that we're going to be always gravitating to. But your lifestyles, and a lot of these on here are lifestyles, are going to be dictated by how you move. How you move is going to dictate your lifestyles in certain situations. If you got tight upper body mobility, you're going to change certain things you do during your day-to-day activities. And over time, that may be impacted. So we need to understand we got to break through all this being a silo. If just because you took a sleep course and now you're a sleep expert, doesn't mean that everything you do is going to be trying to prescribe somebody how to improve their sleep. They may have a breathing problem. They may have a movement problem. They may have a lot of stress. So it's not just looking at these things. It's looking at these things, as you said, make it a priority, make sure they're not at the high risk. Now that's the thing, Gray. Really what we're talking about here is doing a risk assessment.
We are, and a lot of people don't know what to do with that. But if you were going to take a cross-country trip in a car and you took it to a mechanic and say, check this out, I don't want any trouble in the future, I'm crossing the country on this car. If you were getting ready to bring your family into a new house and you could get your insurance agent to come through with a firefighter and do a complete entrance, exit, safety check on your different safety systems, you would do that. And knowing that your mechanic, somebody you trust, said, this car's in good shape, that I don't foresee a problem. All routine maintenance is up to date. Same thing with the house. You got no problem with that. Risk is actually a positive thing because it helped you gain confidence. Doesn't mean you're not going to get T-boned at the first intersection leaving town. It means this car should not fail on you, all things being equal. Most people don't know that about their body. They don't know until they have a problem, and then they get in that silo and get that problem fixed and think they got a clean bill of health. They didn't. That person checked out the one thing you told them to work on. And unfortunately, if you look at the history of healthcare and pharmaceutical sales, 90-some%, if not 99% of the drugs your doctor will give you are to manage your symptoms, not cure your problem or change your behavior.
Yeah, and it's so important for us to get over this stigma of risk being a bad thing. You want to know, all of us should want to know what our own personal risk is. Where are we today, knowing that it's going to change next week, next month. We need to be monitoring all of these factors, all of these gauges, so to speak, because they are going to change based off life, based off what we do, based off of everything that gets in our way. But we have to get past that and realize that I want to know, just like you use the analogy of somebody coming in your house and doing that risk assessment. I want to know where are my problems, and I want to know how to fix those problems. But I need to know how to prioritize them. If as you just said, a firefighter walks in my house and gives me this long list of all this stuff I need to fix, the next question I'm going to ask that person is, you just gave me a list of 15 things. Well, that may cost me $15,000. I want to know, all right, Gray, if you're going to be coming in and give me this assessment, tell me the top 2 or 3 things I need to focus on, because I can do that. I don't need to overwhelmed by 15 things, and that's part of this process.
Well, we often see people who breathe shallow. You got a sedentary job, you're on the screen too much, you're going to make anxiety, and you got nowhere to dump it off. So before you start running 5Ks and get you some goofy marshmallow shoes and buy a treadmill at your walking desk or whatever, I don't need you to do any of that. However, there's a good chance that you're using more tension than you need to. And exercise or just walking after dinner gives us an opportunity to dump that. But let's say you came to me, I noticed you didn't really do well on a breathing screen, which means your breath hold was a little bit low. Really what it means is you're breathing shallow. And anytime if I said hold your breath, you just don't have a lot of oxygen in your system because you're waiting for the next dopamine hit on your screen or at work in your cubicle. It's okay. Because a lot of times we could get you breathing normally just by putting you through a situation that made you squeeze your rib cage and inhale fully. Well, you also have some flexibility problems, Lee. You broke your hip when you were a kid. You're stiffer on one side. What if I gave you a few mobility exercises but added a breathing sequence? And I said one more thing. I've noticed you're not sleeping well. So you're welcome to do this routine in the morning, but about an hour before bed, I want you to sync your breathing with this little stretching routine targeted at it. Dump the tension you were getting ready to carry to bed. Now, here's the way I play it. If I could do this with you long before we had to dig deep into your problems, you will have already leveled yourself up and become self-aware. You may not fix the problem completely, but if you got on a wearable and I notice when you're doing this, you sleep better, we're headed in a better direction, even if you don't feel better just yet, because the breathing screen is upticking. Your breath hold got better, not because you're trying to hold your breath longer. You're working with more residual oxygen on every breath. You slept a little bit better because you dumped tension, and that little asymmetry you get when you get fatigued and you start limping, yeah, we're already working on that. You may not fix it, but you already became self-aware, because I'm getting ready to mob your ankle and tape it, maybe dry needle your calf, and now you can appreciate the work I added as well. You're my partner in this endeavor. I am not giving you a recipe that you're unaware of.
And everything you just described is how everything is combined.
Yeah.
And it's the stacking. So when we get back to this idea of risk and whether somebody's at high risk or low risk, listen, everybody's got a little baggage, right? Gray, I know you don't sleep that well. I sleep great, but I got a little asymmetry in my hip. I've got some other issues. So everybody's going to have some baggage. Just don't have a lot, right? It's if you really take what we try to do, Gray, is try to make things simple, but really the common sense approach. All those 8 factors that we listed, those 8 domains that we know are important. I may have a breathing problem. I may have a little bit of a movement asymmetry, but you know what? I'm going to try to make sure my sleep's good. I'm going to try to make sure my stress is kind of leveled out a little bit. And I'm going to try to exercise and maintain physical activity. So if I've only got 2 of those factors, it's okay. But you bring in a person who's got 4, 5, 6 of those things that are below the threshold. And we're not talking about you got to be great. It's our whole philosophy of movement screening. It's how many of those are below the threshold, not based off our opinion, based off what the data and research has told us. And then, Gray, what you just described, that little story you just said about somebody's ankle, it's figuring out where the first priority is. What's the first domino? What's the biggest opportunity? We need to embrace you taking your own risk assessment.
That's right.
And embrace that, but more importantly, say that's the opportunity.
And let me just give some history. I actually lectured on this at an international orthopedic conference years ago and said, we should take a lot of lead from dentists, because dentists were somebody back in the Old West that until your tooth was rotten, you didn't need one. Then you drank a half a bottle of liquor and they pulled out their pliers, strapped you in a chair and pulled your tooth out. But dentists, more than maybe any other profession that I can recall in my lifespan, became very proactive, right? We want to check kids' teeth before they have a problem. As a matter of fact, we want to check your teeth twice a year. Now, we're going to call it a cleaning, but it's not because we don't think you brush your teeth. It gives us an excuse to have a well touch. Now, you and I both came up as parents where it was very vogue for proactive mothers to have a well pediatric visit. There is absolutely no such thing as a well musculoskeletal visit. You're just walking around one day and your back starts hurting and you take a bunch of stuff and you wear a brace and it just keeps getting worse. And now you're in a category called low back pain. And there's a 2/3 chance you're never going to come back out of that because you think it's one thing. You need it to be a disc, a pinched nerve, or one arthritic facet joint. It's not. It's an entire lifestyle that's perpetuating this. It's going to have some extra weight associated with it. It's going to have some broken sleep and breathing issues associated with it. People walking around with chronic pain aren't using their oxygen, carbon dioxide in a balanced way. Your pain influences the way you breathe. So trying to go to breathing class when you easily have pain, if you sit for more than an hour, let's get the pain checked out first. And so let's go back through a few of our models real quick, talking about that domino effect. If you feel fine and you're getting ready to go do a Spartan race, go through a movement screen. If that hurts you, the Spartan race was gonna, at scale, in a much bigger and more impactful way, at way more G-forces. If you didn't have pain, I don't see you in crisis. But if you got ones on a lot of those movement patterns, those obstacles that you're getting ready to face in the Spartan race aren't the only ones. You're carrying about 6 with you everywhere you go. Stiffness to the left, poor balance on the right, can't fully extend. These obstacles are going to expose that. So you're going to be at either greater risk of injuring yourself during the Spartan race or at greater risk of just not finishing well. Either way, it's not maybe what's for you right now. So when our movement screen, when our SFMA, when our FCS provokes pain, that says let's follow that and let's make sure you're not in harm's way and there's a bigger process going on. Remember, pain is the only way your body can tell you that your behaviors are unacceptable. It's the only way, right? Monitoring will help you refine that information. And I think since wearables are becoming less expensive and more prevalent, when you do have a client that's got significant self-care issues, it's okay. I had a patient a couple of weeks ago that came to me with a chronic back problem. We've been keeping them doing pretty well, but it has come up, and I think a friend had a major back surgery, a fusion, and it's pretty complicated. Well, here's the things I know about this person who asked me, do I think they should get a surgery? They're type 2 diabetic, drinking 4 Mountain Dews a day, with poor sleep, 30 pounds overweight. And I checked their reflexes, and I said, what did your doctor say? He says, I'm heading for a fusion. I said, did he say you needed one by Tuesday? He said, no. He said, this is something I'll know when I need it. I'm like, would you like to come at this decision 30 pounds lighter with a little more sleep and not being a type 2 diabetic? Because believe it or not, you're 6 months away from looking at life through a different windshield. And right now, if you got that type of fusion in your back, I got a feeling you would never even get as good as you are now, which you don't even like. So you're going into surgery with very, very high risk. And you and I have been consulting with orthopedic surgeons lately saying, I wouldn't cut on them right now. If they can drop 3 risk factors before surgery, their outcome's going to be better. And so are your statistics.
It's taking these small little bites. And if we look at some actual people, Gray, to put that even in more perspective that you just did, we take these 3 individuals, and just looking at these 3 individuals, you got 3 very different people that are walking in the door to see you. And the person on the right probably wants to lose some weight. The person in the middle wants to maybe train at a high level. The person on the left wants to lose some weight, get stronger, whatever the goals are. But by taking this approach, we can start to put together a much bigger picture. Now, let's be honest, Gray, nothing we're talking about here is new. I'm sure a lot of people listening are looking at this going, yeah, Lee, I'm checking all those things, but are you putting it in a better perspective for them And are you setting them up? And what we really want to do with this screening process is give them accountability, give the individual more ownership. And it goes back to awareness. If we look at this person right here, we look at all those factors we want to check on the left, functional wellness. Well, movement's right there with it. And we talked about trying to scale this out. So we're not talking about breaking out the test kit. We're trying to make it simple, make it easy. This whole process takes about 15 minutes. So we look at their ability to touch their toes.
That's the whole process.
That's the whole process. Take you about 15 minutes to get through this thing if you do it correctly. And the key is making them aware. But look at this person. It doesn't look bad. Got a little bit of injury history. Again, all of us have some problems. But let's look at her. Now she has got a little bit more baggage. Even though she may look the healthiest, she's got some issues on both sides of the equation. Both her movements are problematic. Let's say she's got some pain, but she's checking the box with behavioral health, checking the box in sleep, checking the box in injury history. Then we take our next guy, the guy that by walking in the door, you're going to already make assumptions. He probably doesn't move well. He probably doesn't, he's probably really out of shape. But looking at him versus looking at this individual, she is worse if we put her on the musculoskeletal health spectrum based off all of the baggage she's got with her. So based off these three individuals, who's at the highest risk? Well, she is. So now the question is, what do we do? How do we tackle her issues? And people go ahead and start thinking about, I would do this exercise, that exercise. She's got a behavioral health problem. She's got a sleep problem. And those are the areas that probably need to be attacked first.
And so since we're getting ready to maybe not attack, but audit some of her behaviors, I don't think you need a psychology degree. The best way to change behavior is change perception. She's probably a little bit wrong-headed about some of the decisions she's making. And just like the guy who was anticipating a fusion, thinking it was going to make his life better, because he could think in reverse. Well, if I can get out of pain, maybe I will get back in shape. No, you're with a physical therapist. I can show you a very fine line of how to get in shape. Even though you may eventually need a surgery, I know how not to flare that up and still get you to a better place. And if I ever can't, we've already got our solution, which is surgery. But one point I'd like to make, you and I go out and teach live audiences. They're chiropractors, physical therapists, athletic trainers, strength coaches, and personal trainers. And they all have the education on fitness, wellness, and health way better than the general public. Do they screen any better?
No.
If we give them a wellness app to screen, and if we give them a movement screen, they don't screen any better. So let me just say this right now. Educating your clients is not going to work, because the people who are our clients are already educated, and they still walk around with no deep squat, poor sleep, dehydration issues, and some nutrition inconsistency. So education is not what we do, but yet, as you were talking, most of the time we see a bunch of golden rules attached to wellness. Well, Lee, I need to get in your face about the 2 that you're breaking, not the 8 that you're doing almost good enough. And so taking this wellness thing and putting these risk factors into measurable things allows us to start tracking and monitoring your behaviors. And that's where I think healthcare has dropped the ball. My mom was put on high blood pressure medication after her last pregnancy. She's still on it, because even though that episode may have sent her into a place, nobody who put her on that anticipated her being on it all her life, because what we've seen is just because we get your test scores down doesn't mean we actually fix the problem and the behaviors associated with that. So if you got to give somebody a temporary medication or a knee brace, that's fine. If they're using that 5 years from now, you didn't give them the appropriate behaviors that could probably remove the need for X in the first place. And so many times we get the symptoms down and assume we've made somebody well. You didn't. You just made them suffer comfortably.
And it gets to back to our fundamental philosophy of screening, protect, correct, develop. We screen, we know the things that we need to be screening out. We want to make it easier. We want to make it more efficient. And the number one goal here, and what we're trying to break through, we're not saying this functional wellness screen is going to solve the problems. We're trying to break through and create more awareness. And we're trying to, what I mentioned earlier, is give them some accountability, because what we're really advocating now is, you mentioned it a second ago, self-care. Get these things in the hands of the individual so they can monitor. They know the gauges that they need to be looking at, because like I said, it's a roller coaster. There are going to be days where certain things are better, days where certain things are down. But if we can make sure that over time you're keeping most of these gauges good enough, then you're okay. And I think for the general population, and that's what we're talking about. If you're a CrossFitter or you're training for a marathon, there's a lot of other things you got to do. But even those two individuals still need to watch these gauges and make sure they're good at good enough level.
Now, there's a point that I want to make here too. By setting a movement screen baseline, whether it be an athletic movement screen or a older adult movement screen, it doesn't matter. If I've got a movement screen on your kid before this season starts and they get an injury or a concussion, I can go back to that level of movement competency and check. And that's an extra measure of safety, because after a concussion, we have a lot of cognitive tests done, but we don't have the subconscious tests done, like balance and grip strength. And we see a lot of weird stuff happen, but if you don't check it ahead of time, you don't have a baseline. Well, if you have a touch with me, whether I'm playing Gray Cook physical therapist or strength coach today, it doesn't matter. If I can baseline your wellness as quickly and conveniently as I can baseline your movement, then no matter what happens here, we can revisit ground zero. And so if I make you substantially better and reduce your risk factors in the process, I can show you exactly where this journey took you. And I think that I personally learned a lot about my own orthopedic. I was already an orthopedic specialist in physical therapy before you and I started kicking around the concept of movement screening. At that time, I was assuming that most of my cases were well closed, meaning the touch with me not only removed your problem, it leveled you up for the future. But I was in my hometown. I had moved back here. You're from here. No, all my failed cases were in Walmart. They were in Food Lion. They were walking on the street. And I would find out I hadn't completed a case. So unless you have a mentor or a really good feedback loop of your outcomes, you don't realize how many things you left undone. Well, the minute I get the movement screen done, this baseline, I don't have to wonder, because I can run you back through that screen on your way out of here and tell you what I didn't do, what you didn't do. And so getting your movement and your lifestyle markers at the same time and place one day let me know whether your movement's your biggest problem or your lifestyle's your biggest problem.
And they're both playing off each other.
They are. So it's not like you're not going to get some recommendations on both, but I can tell you, until you're breathing better and sleeping better, my ambition for you moving better, especially if those two things were not good enough, is far less. I'm going to use exercise to make you breathe and sleep better, not to make you move better. And as soon as you're breathing and sleeping better, then I drop the corrective and try to make you move better.
Because ultimately, anybody walking in the door wants to see improvement, whether they're a patient, client. What we're trying to do is make it a much broader kind of approach, because we first know that people have the baggage. We got to create that awareness. We got to figure out where the opportunity is. And we got to embrace this idea of risk and risk factors, and knowing that, yeah, you're at high risk and you've got some issues. Now, again, whether you had that conversation with the individual or not, but looking at this information, that's where it starts, and giving them the tools and the information. Here's what you need, Gray. Here's what you need to focus on. Not necessarily Lee. Lee's got his own things he's got to focus on, but make it simple, make it easy. And then hopefully if we can do that, we're taking a little bit, one bite out of the elephant, not taking a big bite out of the elephant.
And you and I both know that being involved in healthcare, sports medicine, and fitness for the last 30 years, the person's compliance with what is said has a big factor. Now, if you do everything I say and you don't get well, I got to think about my programming, my process, my protocol, my assessment. I got to think about all that. But the one thing we've always targeted in FMS is not just the area that you're concerned about. It's the other dysfunctions that you have, and many of them can be lumped into that task. But giving you that feedback and being okay with it, because I'll be honest with you, in my exam room, I used to not know how to approach the fact that I thought a major complicating factor with somebody's problem was their sedentary lifestyle, their weight, and their diet. Well, now by actually sort of asking them those questions arbitrarily and seeing where they rank, I don't feel uncomfortable about that anymore because I love them enough to let them know that these are 3 risk factors you don't have to carry into the future if you don't want. 4 Mountain Dews, there's no deficiency in your body that's going to occur because of that. And now they make, soft drinks with stevia or stuff. So my whole point is most people don't want to be knocked out of their comfort zone. But the funny thing is, who's to say your comfort zone is anywhere appropriate? And I'm not trying to put you in pain. I'm saying a little bit of friction can smooth a lot of things out.
And most people don't realize that drinking that many Mountain Dews is impacting their back.
Totally.
Most people don't realize how important sleep is. So not just having the conversation, but now having the ability to show them, hey, this is your biggest issue. This is where you need to focus your energy and effort. And then giving them some basic information on how to improve it. Remember, we're screening these things. We're not trying to be an expert. I'm not an expert in nutrition. I'm not an expert in sleep. I'm an expert, I would say, in one of those domains, and that's movement. But the rest, I can help you and guide you along. But the important thing is recheck. Get the feedback to see, okay, this person, after my little bit of advice on improving their sleep, they're still sleeping poorly. Well, then we may need to take the next approach.
Well, you and I were talking to a batch of people that were taking care of a bunch of young military operators. These are hard chargers. These are guys that are pretty much all alphas. And the one way I said is, I keep this simple. And I said, everybody show me a show of hands who's drinking either a Red Bull, an energy drink, or a coffee after 3 o'clock. And I had a lot of hands go up. And I said, I can tell you, I'd love to screen your sleep and your nutritional awareness because most of you shouldn't need that extra sugar or caffeine to make it through the day if you were nutritionally correct. And because you did that, you're going to have broken sleep as a result. So simply that act alone, reaching for caffeine. Now, do I do it? Hell yeah, I do it. I understand. Some days I just feel like crap at 3 o'clock. A nap would probably get me feeling better, but a cup of coffee will do it a little bit better. But that's at an expense of learning more about my nutrition. When I level up and have a few more healthy fats during the day, I don't feel depleted at 3 o'clock. And if I take that caffeine sugar spike at 3 o'clock, I'm not going to sleep well. So you can see how it's a self-perpetuating cycle. And just by knowing that you have that behavior of reaching for a stimulant when your nutrition and your sleep should easily leave you with enough energy to complete the day at 3 o'clock. And these guys are paid to be alert, and they're reaching for ergogenic aid to do so. And my point is, I'm glad it's available to you. And if you thought you needed it today, you probably did. But please ask yourself why you're going to need it next month if you realize altering your diet and then half a Red Bull tomorrow.
Small little changes and monitor it. Now, again, Gray, just like the functional movement screen, we released that. The first questions we would get was, how am I going to fit this in? How am I going to do it? Well, one thing I'll just, mention as part of what we're doing is announcing the functional wellness screen. We've got some education surrounding that. We got a course, but we also have a platform. We've been spending a lot of time and energy in developing a platform that does this for you, but also gives the individual the opportunity to go through this. So I welcome everyone. You'll get some more information, obviously, as part of this process on how to access that. But we're going to take a break right here and see if Michelle's got some questions for us that she can kick over to us, and then we'll talk more about the functional wellness screen.
Thanks, Lee. Appreciate it. And, the feedback that we're getting right now is just thank you so much for highlighting and bringing awareness to this overall aspect of wellness, right? But one of the questions that came in is, obviously there's certain things that we can control, others that we can't control. So we're talking about, environmental. Maybe they work in an area where there's smoke or, whatever that might be. Well, and the question is obviously we might not be able to change that aspect of their life, but what are your suggestions on helping them navigate that scenario?
Right. I mean, that's a great question. If someone is in an environment that they're required to turn to the left or turn to the right, we know they're going to develop asymmetries. And you just mentioned, what if they're in an environment that there's a lot of smoke and they're dealing with those types of situations? Well, just take the baseline measurement, find out where they are, and to make sure all the other areas and domains are not below that threshold. Again, we're all going to have a little bit of baggage, but don't have everything bad. And if everything's bad, then let's just start ticking off some of those other things. And again, by looking at the data, monitoring the data, if they're at, 10 today, whatever, I'm just throwing out a number, don't let them be 9 tomorrow. Keep it at 10. Try to get a little bit better. But if they're 10 today, and whatever factor that is, wherever domain we're talking about, make sure all the other domains are above the cut. We may not be able to deal with everything, but let's just make sure we get as much out of every other area that we can, knowing there may not be something we can do about that one area.
And I will give you this. I've been in an industrial, agricultural, and athletic environment my entire physical therapy career. Some people are forced to work on concrete. This is where I would seriously consider an investment in footwear and maybe even orthotics if you need them. You're just going to do better. Some people can't control their air quality at work, but you know that where you can control air quality in your bedroom. Get a HEPA grade air filter and have absolutely complete clean air for the 8 hours you're sleeping. So my point is there's a lot of excuses out there where I can't optimize my health, and I'll use those excuses too. But there's absolutely no excuses for not getting a little more functional with your behaviors. So there's a lot of people can't afford a Tempur-Pedic mattress, and things like that. But I will tell you, I live in the South. I've suffered with pollen, mold, mildew, and grass allergies my entire life. When I cleaned up my diet and slept with a HEPA filter in the bedroom, I have no more allergies. So it was a complicating factor of maybe some dietary issues adding to my inflammation. I can't control the air quality in the woods, and I like being out in the woods. I like being outside, but I can control the air quality in my bedroom, and I can control the other inflammatory allergic factors in my life. And so I did, and all of a sudden I don't have allergies anymore. So it's not a solution, but let's right now, how many type 2 diabetics would not have to be medicated if they literally just looked at their life this way? Some need to be more active and their diet's fine. And some need to clean up their diet, don't need to change their activity level, but we don't know who's who. They're all just lumped into type 2 diabetics and they're lined up with a pharmaceutical, and it never ends because they're under the impression that this has to be this way. Only if your behaviors remain this way. If you change your behaviors, we might be able to half your dose. So.
Awesome. Thanks so much, gentlemen. Now, here's the overwhelming question we're getting right now. How do they learn more about this? Where can they find the course? And can you just talk a little bit about its presence and where they can get it?
Yeah, it should be some information provided, on the YouTube. I think down below, I guess, when you go back to our YouTube channel. But you'll also be getting some emails, some of you all that are part of the FMS community. We have a functional wellness screen educational course that Gray and I put together the last several months. It's almost, Michelle, you can speak a little bit more to this, almost 4 hours of content. So we dive deep into these areas. We go through some case studies. We walk people through that process. And then we go deep into the platform that you can also utilize to manage this information. Again, there's a movement component. There's a lifestyle component. I mentioned the platform. There's a piece to that inside that course. So definitely want to check that out. You're going to be, for all you all watching here, is big discounts for members and certified FMS members. You can actually check it out for free right now. So highly recommend diving deep and checking that out.
And I use it as another tool. It's just a movement screening kit, a Y balance test kit. It's basically a hand dynamometer. It's a dry spirometer. It's body comp for me. It's just another tool I use, and I use it 2 different ways. One-on-one with the patients coming to see me, because a lot of the people that are working to see me, it could be a week or 2 before they get in. They can unpack this information on their own, and I get a bird's eye view, and it also preloads some conversations I'm going to need to have. So it really acts as a virtual assistant for me in the recommendations I'm going to make. But there's a source of pride that I take here, and I'm going to go ahead and say it right now. FMS has a standard to uphold, and Lee and I wake up every morning wanting to do that. We don't put those 3 letters on something that doesn't work and something that we don't use every day. When we used this app on incoming college athletes, it lined up exactly with the ones who weren't going to make it to the end of the season because one injury took them out. Not because it was so severe, but because of the complicating factors they had with breathing and sleep and nutritional awareness and past medical history. Secondly, this exact same platform was pitted against our screen team at a university and actually made it into the lit as a valid way to pre-screen people. So the first thing we hear is, I got a big batch of people, I can't movement screen and have a conversation with every one of them. I tell you what, get them on this app and start with the people with a lot of red lights. It's that simple to scale the products and services that you're trying to attach to your particular practice.
Yeah, that's should be definitely understood, Michelle, to the audience and everyone we communicate with. We didn't just slap this together a few months ago. This has been something we have been working on, not just Gray and I, but the entire FMS team and a lot of the community have been working on putting this together since 2017. And that's been a while, right? It's been a number of years that we've been working towards pulling all this together, making sure it's been reliable and valid. And we have actually had a couple research papers produced on this, as well as a few pilot studies that we'll continue to push out in front of our audience. So definitely be on the lookout for quite a bit of more information coming out on this.
Well, a huge thank you to both you, Gray and Lee, for sharing this discussion on this multifactorial approach to overall wellness and how, as fitness and healthcare professionals, we can start to affect change, not just in, joints and bones and movement, but in their whole life to really improve that overall sense of well-being. Remember, it is multifactorial, and we can bring awareness just to help those individuals function in space, because pain's not normal. We want people to do the things that they love to do. Now, Lee did mention this, but I'm just going to put a reminder out there, and I did post it in the chat. The wellness course, the functional wellness course, can be found at functionalmovement.com, and for a limited time, April 28th, we're going to offer 30% off to those in our community if you'd like to go ahead and explore the different domains of that functional wellness. Now, we are also offering a limited time opportunity for our certified active members at functionalmovement.com, which is go ahead till April 9th. This is going to be a free resource to you. Again, you can just go to functionalmovement.com, access the course, and you can register for it and get that into your account right away at no additional charge to you if you are an active certified member of our team. So on behalf of everybody at Functional Movement Systems, we truly appreciate that you took time out of your busy days to be here with us. I know some of you sacrificed your sleep quality to be here with us because you're coming to us from Asia, as was indicated to me. So thank you so much for taking your time to be here. We truly appreciate our community and this opportunity to connect with you. And until next time, everybody, move well, move often. We look forward to seeing you again soon.